some of the things I think are really important to think about is our day-to-day lives and how do we maximize, how do we all become Olivias? How do we go through whatever it is we're going through and not have it define us? And part of that, for me, has always been talking to people about the bone pain, fatigue, and depression, because they really do go together. They are really just one. And how do you deal with that? And a lot of people understand bone pain more than I will, but I do understand that there's some things you can do. So this is, anyone who's talked to me very much, they know that I got stuck in 4th grade, and I always talk about pies. Everything is like an apple pie, and we're cutting up, and we're doing it in 5ths or 4ths or 3rds. But this is how I interpret what someone who doesn't have neutropenia feels. This is just my interpretation of how you deal with life. You need, oops, I'm hitting the wrong buttons. You need some energy to make neutrophils. You spend a lot of time with family. You work hard. And you have some time for yourself. That's how I interpret everyone without neutropenia. This is how I interpret people with neutropenia. You fight infection with a lot of energy. And then you always want to be with your family. And you want to do the best at work. And then somewhere you find maybe some time for yourself. It takes a lot of your daily life when you're dealing with mouth sores, when you're dealing with anything that does neutropenia. It takes a lot. What can we do? We can get that process to change. You start treatment. You start developing neutrophils. You start to have what you need on a day-to-day basis. So you have less time you're spending fighting infections because you're making neutrophils better. You have more time for family, more time for work, and you even have some time for yourself. So the question is, are you ever here? And that's the point of these three, is you're never there. This person who is treated and has normalized counts does not look like this person. And the point of the slide is that's something that everybody has to understand. You are going to feel good, and you should have a life, and you should do all those things. But you must also forgive yourself when you are tired, when you do not get things done, when you need to rest. It's just critical to understand this is good, but this still takes a lot on a day-to-day basis. So it's, the whole message is your normalized cells will not get you back to what we all imagine the normal person is. Whatever that imagine, I don't know if there's anyone here that's normal. I'm not. But we all imagine there's someone out there who has lots of energy, does all these things, visits everywhere, travels. We all imagine that normal person. It's important to normalize your counts. It's important to get that done. It's also important to recognize we're not back here. Thank goodness people that are normalized counts are not here. But it's very important to give yourself that break. Wanted to understand bone marrow just a little bit because it's about when that neupogen, GCSF, comes into the bone marrow, which is located there. And I stole these, so I was sure to put the name of where I stole them from. And looking at marrows, a child, a young adult, and an adult, you can see that we're starting to get the spaces start to seal. These spaces become sealed, and that's an important piece of bone pain, because as you take neupogen, the marrow actually increases in size. It expands, and that is where the bone pain comes from. And so the understanding, and we did this in Imagining 1995, we looked at 20 patients that had been 1 to 8 years taking medication. Most of the pain was lower back, sternal area, or femur. Throbbing pressure is how they describe it. Varying intensity, lasting hours or days. And this increase in neutrophil count, when the bone marrow expands, is where that pain comes from. resolving as the neutrophil counts fall back into a more, and the marrow shrinks. So what do we need to do? Because we're all, anyone who's taking Neupogen, all folks that have a form of neutropenia, they're going to take their medication and they're going to have this expanse, pressing. This is going to get bigger. And the answer that I always want to tell everyone is make sure you know how much you're taking and what it's really doing to you. Is it making your counts too high? Are you dropping too low? And so everyone who knows me, including someone in this room that I just an hour ago said, I want more counts, knows that that's how we do it. You look at those frequent counts and you can say, aha, your counts are too high, your counts are too low, or you have enough bone pain that maybe will adjust even though your counts are perfect. Let's see what we can do about the bone pain. So it's about finding a dose that doesn't cause that expansion, that allows you to have a day-to-day life without that high level of bone pain. It's very critical, or the best you can. Sometimes you're not going to get rid of it. Sometimes it's actually going to be there quite significantly, but you just want the best you can. This example here was for people that take medication less than every day, and I know a lot of people take it every day, but if you take it every day, you can see what happens. You tend to get this kind of flat neutrophil count if you have a congenital or idiopathic neutropenia. Olivia would not have this because of her cyclic neutropenia. For people who take it less often, you get the dips and the rises, and that's a lot of time where the bone pain will come from, is that you're not getting that flat level. And of course, that does not count in cyclic neutropenia. So I love people to keep records. Dr. Dale and I constantly say, are you keeping a diary? It's always coming from us. We'll monitor the neutrophil count, monitor the bone pain, and then let's talk. Let's reach out. For people that live in Australia, I Skype. I Skype to India. I Skype to Pakistan, Cape Town, and I think Guatemala is the only places I've Skyped to. But I do Skype. So we can talk, we can share, we can think about it together. The next thing that I think goes along with bone pain is fatigue. And so fatigue is very difficult because it's just plain tired. Talk about being tired. And I really believe that the key is to understand your own body, to look to see when it is that you are fatigued. And morning, evening, any time at all, when can you build in those times of rest? And again, that's giving permission, knowing that you still need energy to be able to fight infections more than other people. Finding those times, giving yourself permission to have those times. I'm really a big believer in asking for help. Really very strong. I think if you find you've got a good friend who will listen about what's going on for you and be able to give you feedback. Sometimes they can see what you can't see. Family. I think that talking with physicians is very important because they can look at it just a little bit differently. And that's, I think, what at the registry we do. We just try to take a different look. When you bring your information, we just try to see it in a different way and see if there's something that will help. I'm also trying to learn this myself, which is reduce stress by figuring out I don't have to do the dishes every single day. I can actually let them sit in the sink and go put my feet up. This is something that I think we all can learn. What has to be done? We do not have to push ourselves beyond what we can tolerate. So just the messages everyone's heard, but not all of us have learned. So giving yourself a break, realizing you're tired, getting rest, taking some naps, and getting back out. Get out to your life. And maybe just build this in so that you can have more of that life. I also think depression goes right along with the other two. And so the strategies are exactly the same. Find friends. I'm a firmly believe in counselors. Someone who can help you with skill building. Someone who helps you to learn what works for you and what doesn't. I am absolutely convinced. And then I went to each person in the office and I said, we want everyone to have joy in life. You're not neutropenic. You are who you are. The neutropenia is just circles around you. So what is your joy? And each person in the office gave me a different idea. And I think probably Ron has figured out which one of those was mine. But each one of those, and I said, you have only one thing to list that is your joy in life that you're going to do, and you're going to find time for yourself. And each person, that was their ideas. And this was a 19-year-old boy. So he's the only one. We all just looked at him, right? Really? Exercise is your joy? But finding your joy, giving yourself permission to be who you are, giving yourself permission to seek help, allowing people to come into your life and help you. This isn't an easy path, but it's a path that you can go down, and everyone's going down their unique path. And definitely we're here. The registry's here. We want to have you be part of the registry. We want to be part of your lives. I always like to thank everyone who we work with, and that's it. So thank you so much. Questions?